this is Dr. Funk. I'm in Royersford, Pennsylvania. My website's drrobertjfunk.com. My Facebook site's Smile by Funk. Today we're going to start a two-part series on snoring and sleep apnea. First I'm just going to talk about snoring, sleep apnea, and then some of the causes and the way to diagnose it, and then we're going to talk about how to treat snoring and sleep apnea. So sleep apnea is a process where while you're sleeping your body stops breathing, and then you wake up, your body forces you to wake up and to start breathing again. So all night long you go from different stages of sleep, gasping for breath, so your body goes to sleep, you stop breathing, your body wakes you up to a certain level, then you go back to sleep again. So all night long you're basically either choking for air, or you're waking up, your heart rate goes up. You don't get restful sleep. So it's been proven that people who have sleep apnea, have a higher risk of heart attack, arteriosclerosis. Their health tends to be not as good, or they're more prone to diseases than people who don't have sleep apnea. And mainly it's because lack of sleep and lack of oxygen. So the way you can diagnose this or find out if you have it, an easy screening that we use here at the office is the Epworth Sleepiness Scale. So that's about all there is to know. It's a good introduction to sleep apnea and snoring. Obviously there's more to it. For part two, what we'll do is introduce you to what we use in this office, to the appliances we use to help cure snoring. So this is Robert Funk from Royersford, Pennsylvania. Website www.drrobertjfunk.com, and Facebook is Smile by Funk. So tune in and see part two.